school-based setting. Oh, right. Can everyone see that okay? Excellent. Okay. So, first and foremost, because I'm coming from the clinical side of the field, whenever our team gets any referrals, we are looking to see if a patient is meeting the diagnostic criteria that would qualify them for our program. Over here in this box, so here are the symptoms or impacts we're looking at of use over the last 12 months. Over here to the right, it shows us the severity of what the use disorder may be. So if they're hitting less than two criteria, they do not meet the threshold for an substance use disorder diagnosis. 2 to 3 would place them in the mild disorder range. 4 to 5 symptoms would be moderate. 6 or more would be considered severe. So whenever you guys are sending kids our way, or if you're just wanting to kind of get a sense, it's really helpful to um, just know and be familiar with like what we're looking for anyways. Um, and it's a good place to start asking questions, and we'll kind of get into that. So big things, adverse childhood experiences, our ACEs. Our kids and so many of us, I would say, in the mental health field definitely understand the role of trauma and the long-term implications of that. As it were, we're being in schools or you're working with young people, we're meeting them at the points when they are still experiencing or may have already experienced some of these particular adverse experiences. That could include physical, emotional, sexual abuse, domestic violence, mental illness or other disorders in the household, including substance use, any family history of suicide or death, family members who have been imprisoned or incarcerated. All of these things add to the complexity of what our young people are facing. The cool part about this, and I like this over to the left, is that we have our counter ACEs. So this is where we can introduce those things like buffers, like the teachers, like a meaningful relationship with a staff member at school. Um, Whether it's one adult caregiver at home or like in their community that they feel safe with. So these are really great opportunities to reinforce those protective buffers for our kiddos. Oops, sorry. So, let me go back. Oh no. Okay, so substance use. I would suspect that anyone who has worked in a school has worked with families, and families give us a lot of information when we're getting to know our kiddos. So, keeping that in mind, couple things to think about. Um, you may have heard this before, like addiction is like it's a family illness or a family disease. And they say that for many reasons. So one is that students and young people are 4 times more likely to struggle with addiction than the general population. 1 out of 4 children grow up in a home with addiction. Like that, 1 out of 4 kids, you get a room full of 10 kids, 2 of them conceivably, or at least 2 of them statistically have been in, around, exposed to the impacts of active addiction and substance use disorders. There's a 55% of all family violence occurs in a home where there's active addiction. Incest is twice as likely in a home with addiction than one with not, that doesn't have it. Alcohol and drugs is a factor in 90% of child abuse cases. And then 50% go on to marry or have children with other individuals who may have active addiction. This can lead to a pattern of compulsive behaviors into adulthood. That could be use disorders. It could be compulsive use of food, sex, gambling, spending, kind of pick your poison, uh, because our kiddos are learning how to survive in these environments. That being said, there is some upside. Most recently, in the last few years, we are seeing that the prevalence of alcohol and cannabis use among our teen population is decreasing in New York State. So we are seeing a downward trend. This is great. First-time alcohol and cannabis consumption before the age of 13 has been decreasing, and New York State is lower than the national average. Unfortunately, we are a little bit higher for cannabis, but there's the socio-political components of that with the legalization of cannabis here in New York State. All other substances have also been steadily decreasing in terms of use. There's always fluctuations in the trends. Um, Pressed pills with fentanyl or xylazine have been popping up more over the last year. Narcan has its limitations with xylazine because xylazine is not an opiate, and Narcan only affects opiates and the opiate receptors. So, things to educate our kiddos about. Certainly, there's the comorbidity between existing like mental health conditions and the use of substances to help manage those symptoms. And then we are seeing an increase, especially because of the concentration of THC in the products that are available on the market right now. We're seeing a significant increase in the onset of substance-induced psychosis with our young people, or like a serious exacerbation of existing mental health disorders. So moving right along, our trends right now, THC carts, edibles, I'm sure you've seen them. Still cannabis flower. A lot of the teens are like, well, that feels like harm reduction because I don't know what's in the carts. Their logic is fascinating, but it's just worth knowing. I don't know if you guys have seen it, but hallucinogens, especially mushrooms, have been on this steady rise. Alcohol, beat boxes. I don't know if you've come across beat boxes in the school setting. Um, they're floating around. Alcohol is kind of always consistent. Over-the-counter drugs pop up here and there, and kratom. So kratom is a new, gnarly, very frustrating substance because it will have long-term use, will have the same effects of opiates, and they either like there's no contingency in terms of like intervention and like detoxing from kratom. So more to be continued on that, I would say over like the coming like 12 months. Uh, Another thing to keep in mind if kids are, saying like they've got a lot of stomach aches, like the cannabinoid hyperemesis syndrome happens and occurs in some people who are using high concentrations of THC on a very regular basis. Essentially, their body's like rejecting the THC. And so this is resulting in like uh, gastrointestinal issues, weight loss, like the emesis part is like some people are getting so sick that they have to be going to the hospital and be given like IV fluids, etc. So it's really disrupting their system. The only thing that seems to work so far is like complete abstinence from THC. They can relieve some symptoms by, taking hot baths or showering, but reinitiation of like using the THC is going to reinitiate CHS. There are some other things. I think the biggest concern that I have, and I don't know if Melissa can speak to this, is the psychotic features that can be and are being activated with young people and just people generally who have maybe are predisposed to mood or psychotic disorders, things like that, especially
Yeah,
in our,
and I wouldn't say I'm an expert in this area, but there's a couple of links to psychotic disorders and cannabis use. It's not clear the directionality, whether people who are more likely to whether cannabis can kind of induce episodes of schizophrenia, or people
Mhm.
who are more likely to develop schizophrenia, maybe self-medicate with cannabis use early
Yep.
on. But there is also cannabis-induced psychosis, and we're seeing this more and more. And I've actually had a couple of kids in our school mental health clinics in recent years who have developed psychotic features as a result of their cannabis use as a symptom of some of the drugs that they've been using. So it's something that we're seeing more and more. And oftentimes the treatment, it's really important to reduce cannabis use in those cases. It's also really important for kids who have family histories of schizophrenia or other psychotic disorders to know about the link between cannabis use and and psychotic disorders, so that they know that that there is a strong link and one could lead to the other.
Yeah, absolutely. Thank you so much, Melissa. I find that to be true too when we do get those referrals from say like psych inpatient and
Mhm.
having those conversations about family history and their predisposition that puts them at an elevated risk of that and what that means. And oftentimes the kids are surprised when we kind of talk about the relationship between those two things. Let's see. Yeah, so here's some more about cannabis-induced psychosis, hallucination, like everything you would expect. Uh, you may see this in very strange behavior that just may be odd starting in school. Probably hear more of it from like friends and family who are around that student more. Overdose prevention, Narcan, Narcan, Narcan. Uh, Keeping in mind with xylazine, tranq, it is a veterinary anesthetic, so it gives those sedation effects. Um, we do have xylazine test strips now, including in addition to like fentanyl test strips, etc. I think the biggest thing here is just focusing on safety because the kids love to assume that they know who they're getting product from until you ask them where their plug gets the product from and then where they source the product from. So a lot of talk about like just safety. We can't always stop them, but educating them, they tend to be very receptive to. So keeping this is just FYI, keeping in the front of your minds as you're facing kids, like we do have it's a fear and a fear response. You know, when we're using substances, I can say as for me too, as a person in long-term recovery, like I'm using this to try to survive, and my brain and amygdala then becomes hijacked through the compulsive use, and now I really feel like I need to survive. So it's just helpful to have that framework when I'm addressing a person who is in active use because I'm addressing them when they're in their survival mode. So helping conversations, things you probably already do anyways. Listen deeply, normalize their feelings, see if you can, a lot of times it's just suspending judgment. Kids do want to talk. I think everyone is always shocked when they come in and they're like, we can't believe that kid talked to you for 2 hours. It's like, yeah, because we're just having a conversation. And if they feel safe to ask questions, then we can trust that they're getting it from a safe, reliable source instead of feeling like they have to go seek it out from someplace that may not be as reliable or as concerned about their safety. So there are some resources. I heard the tail end for Seneca and Yates, but and we also have our clinic here in Rochester. We're on West Henrietta Road, across from Jay's Diner, and in the part like same complex as Movies 10. That's such a drive though, and I think the access to care is absolutely, especially out in the rural areas, like where I grew up in Wayne County, is very difficult. So that being said, I don't want to take up any more time because I know we probably have a case to get to. But any questions, feel free to shoot them to me in the chat, or you can always contact me. My information is right there too, and I will make sure to send these slides along so that you guys can have them as your reference.
And Leah, I would say we've got a couple moments for Q&A if people have anything that
Yeah.
any burning questions at the top of their minds.
Leah, can you
I have
talk a little bit about Zins?
Oh my gosh, yes. Okay. Zins. The Zins. The kids. It's like whack-a-mole. Yes, the Zins have become increasingly touted as like a form of harm reduction from like the inhalation of nicotine products like vaping. It's funny because even some kids are becoming so averse to vaping that they'll even like go smoke cigarettes or they'll get the Zyn because the Zyn they can pop in, they can carry it around. It's pretty it's pretty innocuous when you're like sitting, or less obvious when they're sitting in class and they pop it in. Unfortunately, the the amount of nicotine in there, including from these more illicit ones that are coming from Europe, have nicotine content that's so high, it's like causing like lesions and sores in kids' mouths. So we're talking about levels of nicotine packed into a little pouch that not only can cause physical damage, but can also lead to like getting nick sick, where they're nauseous, they may feel like vomiting, it's going to act like a stimulant, it's going to rush to their head, but they may start to feel very nauseous and maybe they're like, I got to go to the nurse all of the sudden, and they seem to be okay. So these are the things to talk like to keep in the front of your minds, and to have conversations with the kids if you do find that they're using Zins. Um, my question is like, what do you like about it and what's it helping with? And if you're using Zins, did you used to use vapes and why did you change? So you get a closer, just a clearer picture from their vantage point of like why they're doing the things that they're doing. Um, and they are very responsive to the curiosity as opposed to like the accusations, as most of us are.
Yeah.
So yeah. Does anyone
So
have
approaching,
specific questions about
yeah,
that?
approaching things with curiosity is really critical. Um, any other final thoughts or final questions from the group? I will say that one thing that I like people to be aware of is that primary care physicians are in New York State able to help with nicotine replacement therapy. And what that can look like is prescribing for things like the patch to be used by teens to help them reduce their nicotine dependency. Um, there are many pediatricians who say they don't feel comfortable doing that. There is some technical assistance that's available through the Recovery Center of Excellence at the University of Rochester Medical Center, especially for rural communities. And we can send out some of that information also in our follow-up messages. All right. Thank you so much, Leah. It's always a pleasure to have you here, and I always learn something also about the whack-a-mole game that we have of helping kids address some of the substance use challenges. So thank you so much for joining us.
Thank you so much
We
for having me.
we do indeed have a really good case study for today. We have a colleague from Seneca Falls who